Welcome, and thank you for joining us tonight. My name is Anya Yakubovich, and I am the Director of Sales and Marketing at Kensington Place Memory Care in Redwood City, North Atherton border, a Kensington senior living community offering 2 levels of memory care. Kensington Senior Living has 7 unique communities, 4 located in Virginia, Maryland, and New York, and 3 sister communities located in California. Kensington is truly privileged to support caregivers from coast to coast. Kensington Senior Living focuses on relationship-based care built on the foundation of our promise to love and care for your family as we do our own. That promise was what initially drew me to become part of Kensington organization in 2019. Personally, navigating the highs and lows of being a grandchild in a sandwich generation, I understand firsthand the importance of the compassion and support from organizations like Kensington Senior Living. After working in the aging industry for over a decade, I also see how difficult caregiving can be for spouses and loved ones, especially in today's rapid moving and stressful environment. It is the programs such as the ones that you are attending now that are so important for those of us walking through a caregiving journey to hear from expert professionals on keeping us current with the latest advances in care, management, and treatment of conditions that affect seniors and their families. We are so delighted that you are taking the time to join us this evening with the presentation and hearing from Dr. Ayati. If you're new to the Zoom platform, this presentation is in webinar format. This means your cameras and microphones will remain off and muted throughout the presentation. We will be answering questions that were previously submitted at the time of registration, but we will also answer additional questions submitted in the Q&A if time permits. I would now like to proudly introduce our presenter, Dr. Ayati. Dr. Ayati is an internal medicine physician with Stanford Healthcare and Kensington Place Redwood City's medical director. He brings a broad spectrum of practice and knowledge of general medicine and primary care in various settings, from office to emergency room, acute and subacute care. It is my honor and pleasure to announce Dr. Ayati this evening.
Thank you so much, and I appreciate it for inviting me to this webinar and also for having me today with you. And I'm very pleased to be here this evening and discuss a very important topic, I think, that affects the lives of everyone in our society. And some introduction about myself. I'm a geriatrician in the community, and also I'm teaching at Stanford geriatric medicine. COVID has been a significant change for us, which I'm sharing with you during my presentation. COVID made the medicine divided to the 2 chapter right now. While we're talking right now, we're talking about pre-COVID and post-COVID medicine. Many things has been evolved for the last 2 or 3 years of our life, beginning of January 2020 till now, from December 2019. Which the first time we identified this virus till today, and we're still dealing and with this pandemic. It hasn't been ended, but a lot of things is a preparation for future. I'm go ahead and share my screen and explain it a little bit more, because a lot of discussion we have, it's actually available there. Here we go. Okay. Well, this is about COVID-19 and aging, what we have learned so far and how we prepare for future. I think that topic will be a most important topic for all of us. The one thing that I want to say that I've been personally been involved with the caring of many of the COVID-19 patients, especially in the skilled nursing home area. And I've been witness of the death of many people during this 2 years. And also I've seen many of my staff has been affected by this virus. We still, even many of them that have been infected multiple times, I've seen still a lot of stress, anxiety, depression goes with the entire healthcare workers in this industry all over the world. We lost many of our physicians, many of our nurses, many of our caregivers all around the CNAs. And that's a story. And I'm very sure in the next years, there will be a lot of stories will be written, lots of movies will be produced about what happened in the last 2 years of our lives. But I'm always, again, even I'm in the healthcare section being involved, but I'll have a tremendous respect to every single person being in this industry for the last 2 years. And again, they've showed their braveness and also their work and excellent skills to taking care of the people. We all know about COVID. I think even when I ask somebody at 5 years old that what happened from December 2019, but a novel coronavirus started identified as a cause of the cluster pneumonia in Wuhan, a city of the Hubei province of China. It's rapidly started to spread it. First, everybody thinks this is the flu, and then we have a reality about this SARS-CoV. Still till today, it's very lots of question about what was the origin of this virus. But quickly we found something that happened respiratory-wise and caused a significant respiratory infection, which we all been aware of that. In February 2020, the World Health Organization, they started to announcing the world pandemic all around the world. As we know about SARS-CoV overall, I mean, SARS-CoV is not something that we're not aware of that. We have history of the SARS-CoV from 2003 when we have the first epidemic. But the second one, which was also a scary one, which we all aware of, the MERS or Middle Eastern COVID, which happened in Egypt and Saudi Arabia, it was actually a significant killer. But the one thing that happened that quickly start to eliminate it by itself, and we haven't had pandemic. That was just 2012. It was not very surprising that 7 years later we see another surge of the SARS-CoV some part in the world, but because the world also has been changed a lot from 2012 to 2019. Part of that, we have a very small world right now, globalization. This story never happened in our last generation. Right now, if you have a flu in one part of the world, you can easily get to flight, and in 13 hours, you actually can land in other parts of the planet. And that's why you can easily carry the virus from one place to one place quickly, something that our grandparents, they never had this experience in the past, because every disease was endemic, was just at the local area. But now we have more, again, a small world, small village. And with this globalization is expecting that we're going to see a lot of this spread of viruses, different kind of viruses, RNA, DNA viruses, especially RNA viruses, new kind of in the future. That's something the human needs to think about it in the future, how we can change our lifestyle based on the fact that in the future, we will see more RNA viruses. But I think today our focus is about it's older population that has affected by this virus. And we know that what makes the elderly people at being in the high risk. And we know the majority of mortality happen in this aging population. Overall, the geriatric population was the #1 population that has been affected by this. As you probably know, in European zone, in UK, Italy was one of the first European countries that was affected by this virus. And then Spain, which was a really disaster in the spring of 2020. And then later, some of the other countries, including Germany and other countries involved. But this tree has been affected, especially like in Germany and Italy. We see a significant amount of the older adult people. 55% of the mortality happened in European area happened actually in care homes, a skilled nursing home, long-term facility, assisted living facility. Boy, there is many reasons for that. And this is not only because of COVID. It's because of overall the older adult population. They have multiple reasons that they're going to make them the risk of respiratory infection. COVID or non-COVID, influenza virus for many years, still it's the killer. I still remember 2017, not years from today, just we talking about 2020 was the pandemic, just 3 years before that. I've been witness of the significant mortality of the influenza. In our area, we had lots of cases. I actually lost many of my patients because of this influenza, which is kind of RNA virus. And we still don't have any treatment. There's some antiviral medication available, but again, we still have a high mortality, even in the children. That's why any respiratory viruses, any respiratory microorganism, because they are frail and they have less ability to really able to fight with the situation, their immune system are weak. They have multiple comorbidities. At the same time, they have heart disease. They have respiratory problem, they have asthma, they have COPD, chronic obstructive pulmonary disease, used to call it chronic bronchitis. These are all can lead us to have more pneumonia. They have a higher chance to get quickly what we call blood gas abnormality, means inside the lung, they don't have ability to filter the oxygen getting to the blood and then go moving toward the tissue. They have always some organ involvement. Most of the older adult people, they already have some degree of the kidney diseases. Even they're not on dialysis, but the creatinine is high, or they may have other things like a heart failure. And the other things which is interesting, it's they take too many medications. Polypharmacy, which I'm going to talk a little bit about it. Polypharmacy is always increasing the risk, and there is a reason. Many medication that we use for older adult people, even like, for example, medication we use for bladder incontinence, that we help them with urination, is actually cause significant suppression in the respiratory function, means they're not able to clear their lungs very well. With a lot of psychotropic medication that we use, they have what we call anticholinergic side effect. They make them to not able to, not only they suppress the breathing, but they have technically inability to clear their airways. And that's why they get easily pneumonia. This is always the question a lot of people ask me about that. They have a lot of cognitive and sensory deficit. Why that's affected? They cannot follow instruction. That's so easy. We know many older adult people, you tell them, put the mask on, clean your hand. They cannot follow as we expecting to see. I'm going to be a little bit quick on some of the slides because we just want to be respectful to the time. But there is a lot of things that we see as far as challenge and other issues, which I'm going to talk about it. One of the challenges we see in older adults during the pandemic, it's back again to economic setback, health and well-being effects, ageism and racism. These three topics, we saw it significantly we have seen it for the last 2 years, and we actually been witness. Economic setback. It is a very interesting time because we have experience of 2008 when we have the first recession. And the first people that have been affected by always this recession is always older adults who are in the workforce. During the pandemic, that's something that happened. Many of these people that are age 62 years old, it's just going to be very hard that after pandemic, they're able to come back to the work. Usually because the business are closed, and always whenever it comes to retirement, most of the companies, they're letting the older persons to leave first because they have to pay for a lot of things for retirement later. And unfortunately, that's become a very sad and interesting topic to discuss. It's not for us today, but pandemic, it's always affect the older adult population in different things about the economy. When we have the health and well-being effect, overall, always older adult was the first people experience disruption in the usual services. They have to see their doctor for the physical, for emotional, for social needs. And but when we have this pandemic happen or healthcare system completely collapse and just focus on pandemic, the first people going to be jeopardized will be this aging population. And that's a lot of things. It's affecting them. For example, we know that isolation, anxiety related to the isolation, which definitely affects them. We know even before of this period of pandemic, always we have some sustained social distancing. But then think about the social isolation is always affect this population because their social network will be diminished. The living arrangements going to be changed. The transportation limitation, this is all going to be affect that. And then the other things, as I said in the second slide, that the older adult is always more vulnerable when it comes to this situation. We know also ageism, racism, and classism. Again, I will be very brief. I just wanted to give you today a tips of all the things we discussed these days in the national events about COVID and pandemic and aging population. Ageism, we saw it. Now, when it comes to the ageism, let me tell you that. When it comes to the beginning of pandemic in Europe, a lot of hospitals, they started to filter, to give service to the people, to younger people, to save the resources for the younger people. The aging population saw this discrimination significantly. They haven't had this experience after Second World War in Europe. That was like a shock for them. And still, they are in this shock that things can happen to them. Interesting about that, like for example, a lot of 911, which call it 911 here, but even in New York, a lot of time 911 in East Coast, I will say that when they're calling and they ask about age of the patient on the days that New York was epicenter for the COVID, that what is the age of the patient wants to be transferred. And if there's old, they wait because they have younger people waiting to pick up by 911 with respiratory distress to get there. A lot of this, a patient has been abandoned in a care home in Europe. In Spain, they found in a skilled nursing home, you can look at the news right now, they all should be all still in Google, that many of these people have been left abandoned dead in a skilled nursing home, like 30, 40 people for days, and nobody able to pick them up. And that's something that we always seen that. People with color, we see it in this country. One of the things that we have noticed as well, that low-income older adult, they have a very difficult problem. For example, many of them, they've been worker, but they're not type of work that they can work through the virtual or Zoom. They don't have access to computer. They need to be in the field. They need to be in the work area and the work. That's why when we have pandemic and closure of all businesses, it significantly affect this population and challenges as well. I'm not talking about even distribution of the healthcare services for this population as well. We know the elderly has been victim of the significant depression and because of the significant isolation. Memory loss is always one of the things that we see a lot with depression and anxiety. And I'm sure every single of you, maybe you have a loved one in your family and you notice that these people have been changed significantly. Let me tell you, many of my own patients, before pandemic and after pandemic, I compared them. I was not expecting this decline in many of them so fast for the last 2 years. But in 2019, when I look at my note, they've been extremely doing well, memory-wise and functional-wise. When I see them in 2022, I see totally different people, more short-term memory loss, more decline, and significant changes in behavior. And depression and anxiety is definitely one of them. The number of the psychotropic medication that we use in a skilled nursing home has gone up significantly after COVID. I'm not surprised about that as a physician who is involved with that, because they're all suffer. Even they're not contracted with COVID, but they all suffer from this isolation. And this is the same situation for many older adult people. There's a lot of reports all around the world when it comes to the COVID and suicide in elderly. The first started in the winter of 2020 in China. That's very interesting. This article is from China, and they see a lot of Chinese older adults. They started to commit suicide for this period of time and that was ongoing because these people, during the depression related to isolation and lockdown, they cannot control that. They need to have access to mental health specialists, treatment and medication, and that was not available. Now, we know all of this happened. Why is that? Why it is important to understand why isolation, why this stuff can affect our memory, because that's going to be a good question a lot of people ask. Is it possible? What happened to our brain? I wanted to take you a little bit to physiology to understand why our brain needs this interaction in order to make the new neurons. And I wanted to take you here. Do our brain really makes the new neuron? The answer is yes. When I was in medical student, we were under impression at the beginning that whenever you reach to the age of 7, you're not going to build any new neurons. We know that that's not true anymore. When I was graduating, we know that already this is not right. We know today by neuroscience that even at age of 100 years old, you still can build new neurons. But the difference is that you lose it faster. This is going to be a different topic, another probably seminar for that. But there is a medical reason that why do we lose faster neuron? But that's not the topic for today. Well, technically, the area that you see as a red color here, I wanted to show it here with my pen. This area, it's called hippocampal area. This is the area that we use for, this is the center for short-term memory and learning. This is exactly the area that people have Alzheimer's disease. They have shrinkage in this area. And this is one of the areas that affects significantly. Then technically, whenever you lose the neurons, it's depression, stress, anxiety, no learning, and less social interaction. This is before COVID. We know that. The people have no opportunity to learn, to build the neurons. They definitely have more problem. But what makes them alive is technically learning, physical activity, and positive attitude that we know. The reason is that because in the brain, there's something happen we call scaffolding pattern, which is the pattern the brain able to, whenever the part of the brain is in the problem, the other part of the brain start to recovering or sending new neurons to help that area of the brain that is suffering from that. Well, why this is important? When I said that when you're in isolation, you have no opportunity to interact with people, learning new things. Is it something that we know by science? Yes. It's very interesting. Years ago, there's been a study done in mice, and they found in the mice, if you do MRI of the brain and you put them in the cage, that there's all new toys, that this mice never been exposed to these toys. And after 2 weeks, you do another MRI of these people, you see the area of the hippocampal area, which I said about short-term memory, it's getting much larger, much bigger. And that's something that we see in these people happening. That's very interesting. Years later, we had a study done in United Kingdom. They're looking at different carriers, and they see that taxi drivers in London, they have the largest hippocampal area because it's a driving taxi is a challenge. Means brain needs challenge. Brain needs to interact with many things in order to build new neurons. And mindset is really everything. Stay positive. And that's very interesting because a lot of people said when the doctors, they don't know the answer about my problem, they said, oh, you have anxiety or because of you're in a stress. And that's not right. I agree that. I mean, we always have to rule out the medical condition, but positiveness is so important. One of our wonderful colleague, Dr. Becca Levy, did a study in Yale. In the two group of people, they divided these two groups. One group, they for 2 weeks, they bombarded them with the message that we can do it, stay positive, we can make a change. And in 2 weeks, and the other group in 2 weeks, they just bombarded with the message that we all loser, we all gonna fail, we're never gonna be successful, we all just elderly people, we are depressed. And it's so interesting after 2 weeks, which even two group has the same baseline, the group with the positive messages, they've done much better in their physical therapy, in their functional assessment. And that means that mindset, it can really help with the function as well. Physical activity is part of that that we lost significantly in older adult during isolation. There is no question today that physical activity is always help with less cognitive decline, especially in dementia and Alzheimer. This is not a topic for today, but I just brought it up because we know by science that exercise can reduce the risk of dementia. And many of older adult people, they're not able to do that. We know if you exercise more than 3 times a week, compare with the group of the less than 3 times a week, this is called Larson study, they have significant less cognitive decline. Even in the study that has been done by Dr. Kramer in University of Illinois, they even done in aerobic exercise in 6 months, shows that the perfusion of the brain significantly better and definitely helps the brain volume to get increased. We know the reason, because one of the things happen, it's the protein that released during exercise. They call brain-derived neurotrophic factors. That this brain-derived neurotrophic factor is exactly going to help that the neurons get more connect to each other. It acts like a cement, like a glue that helps the neurons to attach to each other. It helps with definitely your better neuron structure. That's why when you exercise, you increase BDNF. When you sleep less, you have less BDNF. When your nutrition is bad, when your stress is bad, you have less. When you don't have glue, when you don't have cement, this is exactly happening to your brain and is increased risk of cognitive impairment. Technically, this is the photo that we have to see all the time. Older adult people during isolation, during lockdown, they've become more isolated from each other. And this kind of like group activities has been significantly affected our population. Is the continuity of isolation is helpful? We answered, I think I'm able to answer this question. Absolutely not. The isolation and it makes every situation worse. With having the vaccination on our hand right now and starting the vaccination from the time of the first vaccine at Pfizer and Moderna, and then all the other vaccines all around the world, we have the ability to break this isolation, and we have to do it. We have to make sure that while our older adults are protected, they may still contract the virus, but be able to help them to be together. But where are we going from now? And what is going to be the future? I just want to quickly talk about it before I'm going to end up the presentation. What is important to understand that a challenge with aging population, it's not something that just happened during the pandemic or before pandemic was there. This is a challenge that we see overall happen with increased aging population. Everybody knows that we have significant increase in life expectancy over the last centuries. After Second World War, we have 2 things happen in the community. Infection rate is dropped. Don't look at the pandemic that happened after 70 years after that, but the infectious rate has been dropped. We have vaccination, which has significantly helped that the populations is able to survive, and we have significantly less. We have significant less. Fertility rate in all around the world, which happens. That's why we have significant population right now. We know the estimation that happening. Technically, it's very interesting. We see that 2050, we are having from 750 million people of older adult people, we have around 2 billion. Even pandemic had happened. Many of the older adult people have been passed away, unfortunately, in European area, which has the highest number of aging population, but it's still the shift is toward having a significant people, especially 85 to 99 years old. We're expecting to increase 151% from 2005 to 2050, which is 28 years from today. And what the population about 100, it will be increased about 400%. Significant centenaries we're going to see in all around the world. And technically in 40 to 50. In majority of the streets in the world, when you walk, you see more gray hair. That's something that's going to happen, even in the developing country. Which we talk about it is just a lot of diversity happen. But one of the things about that why the politicians always worry about the group of the aging population, it's because the demographic change is not necessarily going to be beneficial. There is the one reason, because we don't have a staff, we don't have people to taking care of them. If you look at this picture, you can see that in the area like Africa or Asia, in 2050, the number of the young people will be less and less, and older people will be more. What does it mean for us? Where are we getting the caregivers usually from? From this area, Asia and Africa. These are the countries that exporting the caregiver to developed countries, Europe and North America. What happened in 20 years from today, when in their area, the populations are aging and younger people, they're not able to leave this area. They have to stay and taking care of the older people in their own region. That's for that reason. Having the caregiver in the next 20 to 30 years will be significant challenge for all the developed countries. You probably hear before COVID, in beginning of 2019, the government of Germany announced the immigration, they have the new immigration law. For many years, computer scientists, they've been the number one, they've always been on demand. For the first time, Germany announced anybody with the skills of taking care of seniors will be the top one, caregivers technically, or the nurses who's able to take care of the seniors. This trend will be significant in the next 10 to 20 years. And there will be a competition in all developed countries to find the caregivers to taking care of the older adult population, if the way that we're seeing today. There's all going to be the challenge we're going to have in the future, and the cost of the caring of the elderly people will go higher and higher. Not only that, there's a significant problem with lack of health professional. If this population is going up, I'm not talking about my field, geriatric medicine. We are around 6,792 geriatricians. Many of them will be retired in the next 5 and 10 years. We're talking about, and again, production of the geriatrician is also very slow. I'm talking about even other specialists, surgeon, oncologists, which we know cancer is growing significant in this population as well. Each situation will be a big challenge for entire world. If what happened in the 20, 30, 40, when we have a lot of aging population with a lot of chronic diseases, and we do not have a specialist to taking care of them. Think about it. These are important. Older adult people, they have more chronic diseases. They definitely have it's a lot of the complex and expensive needs that they have. They need more support and help. They're taking many medication. Every adult person, older adult, take at least 5 or more. They have 5 or more chronic illness, which they have to take the prescription and see different physician. And probably they said 14 different physicians make 37 office visits every year. And those with multiple chronic condition, they account for 71% of total healthcare spending in the United States. But are we doing in the right way? The answer is probably not, because these are the challenges that we see in the future after pandemic. Like, for example, I can share with you a story that when I was doing consult, I had a case that came, there was a demented patient, very severe demented, in boarding care that has a colon cancer at the same time, decided to not touching the colon cancer. Ended up to emergency room because fell down, found that he has bradycardia, which is a slow heart rate. Went to the cardiology, was consulted. They placed pacemaker for the patient in the morning. He was extremely delirious, and he was taking off all his IV, throwing everything, and again, technically asked me to manage his behavioral problem. He passed away in 4 weeks. The biggest question is here for somebody who has advanced dementia and very advanced, and also colon cancer. Why do we need to put the pacemaker? which is the cost of entire procedure, facility, anesthesiologists, hospital bills, and many other things. It just costs significantly. And what we are gaining from this, we actually tortured this gentleman because he had a very painful dying process. And is that going to be the trend that we are looking for future after pandemic? I believe that we need to think twice again about every single definition that we have. Let's just not talk about US. Before pandemic, beginning of 2019, just the starting of 2019, there was a word that was really shaking. It was on BBC Word that the most of older adult Japanese, they intentionally commit the crime to go to jail because they cannot live by themselves. Their retirement plan is not going to pay for this stuff. They go pick up the bicycle. It was a very sad story. And I highly encourage everyone to read that story and many other stories in other countries like South Korea or Japan, which has the highest suicide rate for older adult population. And this is the trend going everywhere in the world. We don't hear that in the news a lot, but their loss of news is going. The sad news about these countries, Japan, South Korea, China, that they have a highest market for anti-aging. They pay billions of dollars for fighting with aging, while many of this aging population in their countries, they end up to go to jail because they cannot live by themselves. In the United States, the anti-aging market is going to be $271 billion in 2024, 2 years from today. If only one small percentage of this money that we spend for fight against aging is spent to provide better care for older adult people, we have a totally different conversation today. Lives of many of these people will be significantly changed. And these are the things that probably COVID may taught us about that. The positive lessons, they all talk about negative lessons. Let's talk about positive lessons. There are a lot of the positive lessons we have that during COVID, one thing that happened, the people learned to become more united and more caring with each other. I could see that. When the pandemic started, which is a really difficult time for me at that time because it was some personal things happened, and then at the same time I got a call that the pandemic lockdown start to March 16, 2020. I never forget that day. And then many facilities that didn't have any personal protective equipments, and we have to be involved. I was driving from one facility to one facility, took everything from my office and just tried to distribute. It was a very bad days, but I've seen that even like people in neighborhood and many other areas, they started to share the kindness, any resources that they have. Yeah, I've seen this that we were been hoarding the toilet paper and many things at the beginning of pandemic. These are stories, we've seen that as well. But we also see beautiful stories. Don't forget that. And I'm hoping that we see more beautiful stories in the future. We found our deficiencies very well. We found that we have significant deficiencies in our healthcare system, where hospitals are not ready for caring for pandemic, or care homes, including a skilled nursing home, boarding care, and an assisted living facility. They need more support. They need higher skilled people. They need to really be trained more about the infectious disease in the future. The new variants is coming, not COVID. Again, I said there's going to be a loss of new RNA viruses in the world, that they will mutate and they will come. Some of them may become endemic, some of them they become epidemic, and some of them they become pandemic. But we will expect to see more and more and more. We need to support our care homes. I've just used this general term, that we need to provide education. We need to support them. We should not blame them. We need to support them. They need help. They need resources. They need education. They need to have, whenever it's going to be the problem, we need to step up and help them, because some of them, they're not medically licensed facility. We have a lot of things we learn. For decades, all the companies, university, they started to cutting funds of research. And now we know that more funds needs to go toward that, because research, science saved us Science will save us in the future. There's no question. We need to have funds to support the aging community, and this is this is very important. Precautionary measures. This is very important. I saw one of the first questions said, "What happened that now we are all on mask?" That's true. Let me tell you that before COVID, if you enter to any medical facility, you see there was a sign of please put your mask if you're sneezing or if you're feeling cold. Nobody pay attention to that sign. They're always putting a box of masks and gel, alcohol gel in front of every healthcare facility. But less people even paying attention. Many people, when they have flu, they still go back to work. They have no knowledge that if I have a viral infection, I can infect many people. For me, better to stay at home and not affecting other people. The kids the same. The schools are the same. We need to continue education for patients. I don't see that education anymore after the pandemic. They're trying to minimize to not talking about it because they wanted to, because there's lots of politics. A lot of people say, okay, that's enough. We don't need to share with people. But I think that's exactly the wrong strategy that we have. We need to educate people again and again and again, not for COVID, for lots of the new RNA viruses that will come up. It may not going to come this year, but will come next year, maybe 5 years from today. We need to teach other people, and then other people need to learn that yes, if the viral infection, the cleanliness, washing your hands, if you are sick, putting your mask on is important. If everybody really pay attention to this, we're not going to have a problem. There's no problem if you're controlling the passengers when they're traveling from one part of the world to other part of the world. That's okay. I know that there's a lot of money, there's a lot of screening, but that's the way we probably need to think about the future if we wanted to fight with pandemic. The other things that we learn a lot during the COVID is older adults, they started to have a little bit more attention to their lifestyle. That's very interesting because before, when we talk about lifestyle, they're not very interested to learn about it. But I see now that people are actually thinking about exercise, stop smoking, drinking less, paying more. Because why? Because we see many people that have been victim of the dying situation of COVID. They've been unhealthy people. The people, they have underlying metabolic disease, cardiovascular, smoker, asthma, or many other things. That's why it is important to understand that. The other things that we learn is that we should avoid polypharmacy. We should not take unnecessary medication that may affect our body or immune system or affect our strength of our body as well. The other things was very interesting is the connectivity of older adults. Many of the older adults improve in technology. Now they're able to use Zoom, they're able to use virtual. And that's even before pandemic, that was the kind of a steady grow in the number of the tech savvy older people. And that's very interesting because, like, for example, in 2013 to 2017, it shows that there has been increase of ownership of a smartphone in people age of over 65. We saw the video conferencing. We saw the young people and older people in the family, they start to do FaceTime with each other during the isolation and lockdown. The grandparents able to connect this way. These are perfect. We need to connect this one more to each other. We see the family and intergenerational connection has been grown stronger and stronger. Many families just started to build a new relationship. Many children move. Many parents move to the area that the family members that are there. This is a positive things happened with COVID. That was a really good things that we have. The other things that happen is inside the society, we see the younger people, they started to do shopping through the online access for the older adult people. We see a lot of, we call Zoomer to boomers, intergenerational grocery delivery services. These are the positive things actually we learn. I hope we don't stop it. This should continue forever. And again, the other things that is so important I think it's not for the first time. I think after Second World War, that was the first time The modern human think about dying. Every single of us, we felt dying. It can be next to us in any minutes, in any hour, in any day. It's never been close to us. COVID made it very close to us. It's like a gamble that maybe you're going to get the bad card and you're going to be the next person, victim of this RNA virus infection. This is why a lot of the people that they've been in denial of thinking about my wish to how to die, they started to open up this conversation. And a lot of my patients, they came to me and said, Dr. Ayati, if something happened to me, I want to do this. Please don't do this. And that was a great conversation that was started after the COVID. These are positive. These are not negative. At the end, when the COVID happened, it was a lot of before lockdown. I mean, the couple of days before lockdown, I lost my own mother. And it was a time that I said, okay, well, lockdown is a perfect time for me that I find a peace for myself and help myself to kind of like a little bit have a peace, but it didn't happen. Because the minute that I got, just the day that I got the message about my news about my mom, the afternoon, it was the 20 calls on my phone that we need help. And there was lots of facilities that they don't know what should they do. And that's why I always use this, that no times for graceful rose when the forests are burning. I wanted to thank you so much. And I wanted to answer some of the questions that the initial was asking about me, as asking about it. One of them is that about vaccination. The vaccinations will be possible annual or every 6 months vaccination for COVID for every single of us, especially older adult populations, like a flu vaccine. I wanted to tell you that before COVID, there was a discussion that we should do flu vaccine probably twice a year. Once a year, maybe not enough. There are lots of experts that are talking about it because we have two different kinds of the influenza. Some of the people, like for example, when we have our winter, there is a summer in Australia. When you have our summer, there's a winter on the, Australia, New Zealand, Oceanus area. And that's why there may be some mutation at that area. The passengers can bring in this here. And then we have influenza. That's why we may be better to have twice a year. That's probably going to happen, the pattern for many RNA viruses. Moderna and Pfizer vaccine, they're all both mRNA vaccine. And there's a high possibility that we may need to have a booster twice a year or maybe once a year. Booster vaccine is not something that is new. We always do booster for many, like for example, I don't know if you have any hepatitis, we always do one hepatitis, 1 month, 6 months. We have same thing for diphtheria. Every 10 years, we do tetanus shot. This is the boostering, and in order that your immune system be activated. Too much boostering is not good, but it really depends on the science in the future that when you're neutralizing antibodies start to decline. And then the other things about emergency authorization, there was an initial when the Pfizer-BioNTech vaccine started to have emergency authorization. That's a very common path. Usually in emergency authorization, you don't need to have a post-market study. You technically rely on the study on phase 3 trial that you have, and then you have the emergency authorization, and then you observe in the general population. And that was a right decision to authorize the emergency authorization, which we had on many times in the past, but that was the right decision. But now, both mRNA vaccine, they're passed beyond emergency authorization, and they got a full authorization from FDA because there shows effective vaccine. It shows that they're effective. The side effects are minimal. I'm not saying it's zero, and technically it's a good vaccine. Let me stop my sharing, and I think there are maybe some questions, or maybe Susan, you can help us with questions if there's any questions.
I would love to do that. And
please,
Dr. Ayati, I applaud you. And I am just so pleased, proud, and grateful that you are a medical director at Kensington Place, because that was a phenomenal presentation. And my connection is my father was diagnosed with Alzheimer's 10 years ago. And at that time, there was such a stigma associated with it. It was people like you that are bringing this disease, understandably, in a conversation, and we can really help people. And you talk about the caregivers. and you were talking about the caregiver challenge and how that's going to be exacerbated as we're living longer. And as you know, and as I know, especially with someone with dementia, there's an average of 5 caregivers for that individual person that's had the diagnosis. And I went through the same thing with my father, where they wanted to do a surgery on him when he, was completely gone, and I didn't want to utilize the resources of the hospital. So, but I had my challenges with hospice and everything. And I think the more education that we can bring to the dementia community, the better. So I really applaud you for that. And I really thank you for that. And my dad did live at Kensington Place for over 7 years and had phenomenal treatment. So I'm really glad you're there. The community's pretty amazing, and it is dedicated memory care. So I thank the entire team at Kensington as well. I loved what you said about stay positive. And I think that's so important that everyone really, really challenge themselves with staying positive. But we do these educational webinars at Kensington, and we're really trying to make them positive. So I really encourage everybody to sign up for our webinars. We have the educational webinars, as we're seeing today with Dr. Ayati. We also have fun webinars about healthy cooking. We also have fun webinars about exercise and brain health, which brings me to a question from Jasmine, Dr. Ayati. She says, eating healthy is important, but can it actually slow cognitive decline?
Yeah, that's a great question. Healthy diet is actually shows that has effect on. It's not curing the problem. Let me just say that, but it definitely help to decline, to slowing the decline, especially for people that have mild cognitive insufficiency or mild dementia to more advanced dementia. Some of the study shows that, like for example, in this example, they call Mediterranean diet. The Mediterranean diet by study shows that definitely is lowering this decline and help. And we know the reason is because it's contained of the high quality fat, not the bad fat, which we call high density lipoprotein or HDL, which that's something the brain needs. It definitely has less unhealthy fat and unhealthy carbohydrates in that diet. And that definitely helps with the brain structure, because what we learn is possible that the cascade of the disease, especially for Alzheimer and many other one, it's a microvascular problem that happens, and a lot of inflammatory cells going to be released. That's why it is true, actually, or food is our medicine, and that's very important things that we need to learn, that it is important to have a healthy diet. And yes, the answer to you, Yasmin, is it shows so far by neuroscientists that is effective. We see the people, they have more unhealthy behavior, especially as far as like a diet. They have a higher risk to develop vascular or Alzheimer pathology.
Do you agree, though? I loved your slide about the combination of things that you can do that are not brain science. I mean, I hate to say that, but they, just the exercise. And I loved what you said about challenging ourselves, like the elderly population with COVID challenged themselves technically. And I think the combination of those things, obviously not smoking, drinking less, exercise, the Mediterranean diet, sleep, maybe meditation, if you can add that in. I think all those things combined can really assist in the decline.
Absolutely. This is not, I personally believe that. This is shows in science, and I can tell you for sure in my own experience as a patient that they started the journey with me in the mild condition, when they've been able to do these elements that Susan says very well, again, exercise, diet, and stay positive, social interactions, joining the webinars more and learning and education.
Exactly.
These are all factors. I've seen that they've done much better. Believe me, I've seen these people still, after years, coming to me, and they stay in the mild stages, and they haven't developed or progressed so fast toward the advanced disease. The answer is absolutely yes.
And I will share with our audience, everyone will be receiving within about 2 days a copy of the webinar and links to the resources that you've heard today. And I encourage you to share that with your friends and family, because I think I agree 100% with what Dr. Ayati said today, that the more that we can connect the community, the more that we can share our resources and what we know, the more we can help people. And before I introduce Joan Newman, I just want to say one thing, that you talked about globalization, and it's so true, right? The world is getting smaller. You talk about, you get on a plane and suddenly we have a new disease, or and then you talked about the caregivers and the impacts of caregivers. And I couldn't agree with you more. As we get older, you know, what are we going to do? Who's going to take care of us? So I'm thinking about moving to the moon. No, but Dr. Ayati, thank you so much. Please stay on, and I'm going to stay on, and I'm going to introduce Joan Newman, who is the executive director of Kensington Place, a community near and dear to my heart. So thank you for joining us, Joan.
Oh, thank you, Susan. And thank you, Dr. Ayati, for this informative presentation and for being our medical director. We're just so fortunate. I'm the executive director at Kensington Place, and we are in North Atherton, right off of El Camino. And I really encourage everybody to come and look at our website and learn about all the wonderful presentations that we have available and all the information available to everybody. So thank you both so much.
And thank you, everyone. Thank you to our audience. And Dr. Ayati, I look forward to hearing you from the Commonwealth Club in San Francisco in December. Please give us that information. We'll send that to the audience. Thank you, everybody, and be safe. Have a great night.
Have a good evening.